Hello everyone. So today I'm going to talk about COPD. COPD is chronic obstructive pulmonary disease. So how is it different from asthma, bronchial asthma? So it is chronic. It is irreversible. Now asthma is reversible. Okay? Asthma is intermittent. So there could be an asthma attack, there is inflammation, bronchospasm, bronchoconstriction, but on treatment the patient gets back to normal. Yes, the patient is prone for more asthma attack, but it is reversible and intermittent. Whereas COPD is irreversible because of the permanent damage to the lung, and it is progressive. Now it is progressive, so as nurses, as doctors, our aim should be to slow down the progress and also to improve the quality of life of the patient. Now, COPD can be broadly divided into two. One is emphysema and the other is chronic bronchitis. So, emphysema is also called pink puffers. I'll tell you why it's also called pink puffers, or bronchitis is also called blue blotters. Now before that, let's talk about the risk factors. Very important for NCLEX, capstone or USMLE. So Kaplan, the major thing is, the major risk factor is smoking. And smoking for more than 30 years or even a chronic smoker is prone for COPD because it does irreversible damage to the lung. Now, in addition to smoking, there are many other respiratory secondary causes, such as respiratory irritants from chemical fumes, forest fire, or automobile. So, occupational hazards, such as those working in the automobile, or mechanics, car mechanics, or firefighters, they could also secondarily inhale respiratory irritants, which can lead to COPD. Now, in emphysema, what happens is, we all know, in the lungs, you have the bronchi, primary bronchi, secondary bronchi, bronchioles, and the alveoli. So there is damage to the air sac, the alveolar sac. It loses elasticity. So it inflates like a balloon. And what happens? The consequence is air is trapped here, right? So there is air is trapped here, which leads to increased carbon dioxide being trapped here. So hypercapnia. Now there is hyperinflation, hypercapnia, that is increased CO2 is accumulating because your air sac is inflated. It has lost the elasticity because of the damage. And there is hypoventilation. There is difficulty in breathing, shortness of breath. Okay, there is hypoxia. The patient is not able to effectively use the gas exchange, oxygen. So that is why emphysema is called pink puffers. Pink puffers because they are not cyanotic. There is no hypoxia. There is accumulation of CO2 and there is shortness of breath. And because of the inflation of the alveoli or inflation of the lung, the chest appears barrel shaped. So they have barrel shaped chest, and because of the breathing difficulty, they might be doing pursed lip breathing. So COPD patients might often say that they feel as if they are breathing through a straw. So pursed lip breathing, like with mouth slightly open like this. And cough is minimal, but then this is emphysema. Okay. Now moving to chronic bronchitis. In chronic bronchitis, what happens is there is chronic inflammation of the bronchi. Now chronic inflammation means excessive mucus production, obstruction. Again, in this case, the patient will present with cough, chronic hacking cough with a lot of sputum production or mucus production, and there will be cyanosis. That is why it's blue blotters. Okay, cyanosis is decreased because of decreased oxygen. There could be bluish discoloration. In addition to this, chronic cough and cyanosis, these patients can also have peripheral edema, swelling of the legs, and also clubbing. Clubbing is bulbous enlargement of the fingertips. This is also a sign of chronic disease and low oxygen tension for a long time, hypoxia for a long time. Now, moving on to how do we manage it. So as an action care plan, we should first address anxiety issue. Obviously, a person who is finding it difficult to breathe would really need help. Second is oxygen therapy, medications such as bronchodilators or corticosteroids to reduce the inflammation, antibiotics. Now, because a patient with chronic bronchitis, a COPD patient, you have to warn them that they should come to the physician in case they experience shortness of breath, or there is a change in the sputum, mucus color, or a sudden increase in cough and mucus production, because there could be exacerbations, and if it is treated early, it is better, which would prevent a hospital stay. They should also take precautionary measures like first and foremost, like I said, the single biggest risk factor, smoking. So smoking cessation, take help, seek help too. It's not easy, but you have to. Smoking cessation is the primary prevention. Then you can also ask them to wear a mask, avoid crowded areas. Okay. Then secondly, what we're going to talk about is oxygen therapy. How could you deliver oxygen? Through a nasal cannula, to an oxygen mask. You could teach them breathing techniques, because many of them, while they cannot do any physical activity because of the shortness of breath, so slowly increase the physical activity, teach them how to use the medications, breathing techniques such as pursed lip. Pursed lip is you breathe in slowly through your nose and breathe out through your mouth. Now this helps in more deep breathing and more oxygen availability. Similarly, there is another thing which is called the diaphragmatic breathing. Diaphragmatic breathing is breathing deeply. This is also a breathing technique which can be used. Now, one more thing is a typical patient with emphysema and chronic bronchitis or COPD. Another presenting complaint would be, in addition to shortness of breath, cough, sputum, in case of chronic bronchitis, is tripod breathing. Now, tripod breathing is bending forward with hands on your legs or even your elbows. Now, this posture helps in breathing better, and therefore you might see many patients with COPD doing a tripod pose. Thank you. That's all.